Hi, I'm Dr. Wendy Warner. In my clinical practice, many, if not most of my patients present with physical symptoms that are actually related to stress. It's not uncommon for me to hear stories about things that they're concerned about, everything from family issues to financial concerns, even fear about losing their job in today's economy. What they don't understand, though, is that these physical symptoms are actually caused by the emotions that they're feeling. As a holistic physician, I have many tools that I can use to help these patients deal with their concerns and their stress. What I find is often the most effective, however, are the HeartMath techniques and technologies. These allow patients to take control of their own health and deal with their own symptoms of stress and anxiety in a positive way. I also like the fact that they are free of any side effects. Let me tell you a little bit about a couple of patients. One patient is a woman in her early to mid-50s. Her husband, who had a contracting position, had just lost a big account, and she was the only provider in the family. They have 2 teenage children that were having some trouble in school, and she was having a lot of trouble dealing with them on an emotional level. She came to me complaining of insomnia, perimenopausal symptoms, anxiety, and inability to focus at work. What was interesting is that in addition to being the one in charge of the family, so to speak, she also was the person at work who seemed to be in the motherly figure. She was the only woman her age. Everyone else was either a man her age or much younger men and women. So she was seen as sort of the matriarch and the person to go to be taken care of. She had typical symptoms of overcare. After some work with me, in addition to starting some supplements and doing some yogic techniques, she had a visit with our one-on-one provider in the office, and he taught her the HeartMath techniques of attitude breathing and quick coherence. She walked out the door with an M-Wave PSR, and she said at the time, "I finally feel like I have some hope." Very soon, she was back to sleeping appropriately, and her anxiety and panic attacks were gone. The weight that she was having trouble losing was also coming off. She's found over time that the HeartMath was probably the single most important thing that was helpful in her recovery. I need to also tell you about a whole family that I ended up seeing. It started with a 22-year-old college student. She was having trouble with anxiety attacks, panic attacks, trouble focusing at school, and she couldn't even drive without getting anxious. So she came in, again, was taught the HeartMath techniques by our one-on-one provider in the office. She also was given some supplements and some other techniques to do as well. And she found that within a few days, she was sleeping better and the anxiety attacks had ended. The interesting thing is that shortly after that, her father, who had brought her to the appointment, made an appointment with me as well. He's a small business owner. There was a downturn in his own work, and they were having to downsize their home for financial reasons. He suddenly had developed some hypertension and some elevated cholesterol, as well as some anxiety and insomnia himself. So he came in and also learned the same techniques and found them very helpful. Shortly after that, the 16-year-old sister showed up for a visit. She was having trouble with anxiety and insomnia. She's also an athlete and was finding that her skills in her running were decreased, and she was having trouble focusing at her meets. She was also taught the HeartMath techniques, and at this point there were now 3 people in the family who were practicing with the HeartMath techniques, and they were all sharing some of the technologies. The last person to show up was the mom. She was having anxiety and worsening of her perimenopausal symptoms, and she also wasn't able to sleep. I, of course, had a conversation with her about the fact that she was the last one in the family to show up because she had some pretty typical symptoms of overcare as well. At this point, all of them are practicing the same techniques in addition to doing some other supplements and some specific things for each individual person. But they're finding that it's the HeartMath in general that's doing the most for them in terms of getting them back to being balanced. I find that the HeartMath tools and technologies are a wonderful adjunct to almost any other techniques and tools that you're practicing to improve your own health and well-being. HeartMath is currently offering a number of online resources and free webinars that I think are worth your time and attention. I use these tools in my practice frequently, and I find that they're one of the most helpful things we have available to lower stress hormones and improve your health and well-being in general.